Friends, today we'll discuss about scanning technique, that is 10 tips and tricks of scanning of gallbladder. First tips, patient preparation. Keep fasting for 6 hours. Better to go for overnight fasting and morning ultrasound examination, which keeps full gallbladder and less amount of overlying gas for interference. As I have already told, gas is not sono friendly. Second, probe selection. Generally, curvilinear ultrasound probe is used for abdominal examination, which is having frequency 2 to 5 megahertz. In case of obese patient, lower frequency is used for better penetration, as penetration and frequency are inversely related, as one is increases, another decreases. Third, patient position, supine position, left lateral decubitus position, erect or sitting position. Out of these three positions, we generally do the examination of the gallbladder with supine position. But when difficulty arises, you can go for left lateral decubitus and sitting position, which allows the gallbladder to drop down. But in any type of position, you ask the patient to take deep inspiration and hold the breath. It causes diaphragm, gallbladder, and liver to drop down, which results gallbladder will be in our focus. Fourth, type of approach. Two type of approaches are preferred. First, subcostal approach. Second, right lateral intercostal oblique approach. In both type of approach, liver acts as a window. That means in both type of approach, first we will see the liver, then we will see the gallbladder. That means liver is a sonographic window. In subcostal approach, keep the probe at x minus 7 position. X means Gifford process. 7 centimeter from the Gifford process. That is 7 centimeter right lateral to Gifford process. Put the probe just below the rib cage and angle it towards the right shoulder. Fan the probe and send beam from different angle. Never keep the probe at perpendicular position. Never keep the probe static. If you keep the probe at perpendicular position, it will not hit the gallbladder. That means gallbladder will be out of the image. Keep on scanning till the probe, till you get the gallbladder. Now see the resultant image. When difficulty arises or gallbladder is not scannable, we can go for left lateral decubitus oblique approach. In this approach, more amount of liver tissue is used for ultrasound examination of gallbladder, which creates more beam attenuation. Fifth, how to recognize gallbladder during ultrasound examination. Always search for right portal vein. It will help you to diagnose or recognize a gallbladder. There are two type of hollow viscous structure are present. One is gallbladder, another is duodenum. Food particle inside the duodenum which confuses with gallbladder. That's why right portal vein and MLF main lobar fissure. These two structure will help you for recognizing a gallbladder. Look at the picture where MLF main lobar fissure and right portal vein both are on the picture, which will help you for recognizing gallbladder during ultrasound examination. gallbladder, right portal vein, and main lobal fissure. These three structures will form exclamatory point or exclamatory mark for easy identification of gallbladder. What is main lobar fissure? Main lobar fissure is a echogenic line or a bright line which extends from gallbladder and portal vein, which serve as a landmark. See the semantic diagram where all the three structures are present: right portal vein, main lobar fissure, and gallbladder. These three structures form exclamatory point or exclamatory mark for easy identification of gallbladder. Look at the some ultrasound images where these three structures form exclamatory point or exclamatory mark. Remember, exclamatory mark help you for easy identification of gallbladder during ultrasound examination. Sixth, now discuss about sonographic dimensions of gallbladder: length, width or diameter, and thickness. Remember, length should be measured in longitudinal section, but width or diameter and thickness should be measured in transverse section. Again, I am telling, length should be measured in longitudinal section, width or diameter and thickness should be measured in transverse section. Length up to 7 to 8 cm is normal gallbladder. Length more than equal to 10 cm means it is abnormal or distended gallbladder. Width or diameter up to 3 to 4 cm means normal gallbladder. Width or diameter more than 5 cm means abnormal or distended gallbladder. Thickness less than 3 mm means normal gallbladder. 3 to 4 mm borderline and more than 4 mm thickness means abnormal gallbladder. Seventh, assess cystic duct, neck, body and fundus of gallbladder by keep fanning your probe. By sending beam from different angles, you can examine the above structure. Search for folded fundus, that is Frisian cape, or septation inside the gallbladder present or not, which are main culprit for stone formation. Eighth, check with color Doppler for any increased vascularity of the gallbladder wall or any echogenic structure inside. Remember, inflammatory gallbladder wall having some vascularity, but in case of malignant echogenic structure inside have more vascularity, but polyp having single feeding vessel inside. Ninth, take two section of gallbladder always, longitudinal section and transverse section. You can begin with longitudinal section or transverse section. While taking longitudinal section, the probe marker should be towards the patient head and you should fan your probe laterally and medially. While taking transverse section, the probe marker should be towards the right side of the body and you should fan your probe cranially and caudally. Again, I am telling, while taking longitudinal section, the probe marker should be towards the patient head, and while taking transverse section, the probe marker should be towards the right side of the body. See some ultrasound images of gallbladder with longitudinal and transverse section. Look at, while taking longitudinal section, length should be measured, but while taking transverse section, width and thickness of gallbladder should be measured. See the images. 10th, how to scan a gallbladder. Remember, patient fasting should be for 6 hours. Second, curvilinear probe should be preferred. Patient position may be supine, left lateral decubitus, or erect or sitting position. Two type of approaches: subcostal approach or right lateral intercostal oblique approach. Remember, you should keep your mind about x minus 7 position. You should keep your mind on right portal vein and MLF, main lobar fissure, and exclamatory mark. These are the points for easy identification of gallbladder. Remember some points how to scan a gallbladder. First point, keep the probe in x minus 7 cm position. X means xiphoid, that means 7 cm right lateral to xiphoid, subcostally just below the rib cage. Second point, send beam from this position by angling or tilting it towards patient right shoulder, not keeping the probe perpendicular as it may not hit the gallbladder. Third point, keep fanning the probe, that is, don't keep the probe static. Send beam from different angles, different plane, different sections. Fourth, keep on scanning till get the gallbladder and see the resultant image. Fifth, then turn the patient to left lateral decubitus position to get a better image. Sixth, ask the patient to distend the abdomen as gallbladder descend down and it will be seen on the screen. Seventh, first search for right portal vein for recognizing gallbladder. Eighth, always take longitudinal section and transverse section of gallbladder. If you are beginning with longitudinal section, rotate the probe anticlockwise to take transverse section. If gallbladder is not scannable, that means gallbladder is deeply seated, then scan the beam from right side of the patient. In this position, gallbladder is scanned through more liver tissue, so beam will be more attenuated. Thank you. Thanks for watching.